in the last few years, the access to healthcare and health information is still a major issue in developing countries. And especially for lower resource communities in those countries, access to healthcare, basic healthcare, is still problematic, and especially for health information. And one of the things I was looking at is that the mothers in those places, especially with the young children that need information regarding care of their children and care of themselves, still have problems to access those kind of information that they need, especially after delivering the baby in the first year of taking care of the baby. So basically, what I'm thinking is that ICT can play a role in this. mHealth has been growing the past few years, and many mHealth applications have been developed and implemented in many countries across the world. And in developed countries, it's already in an advanced stage. In developing countries, there are mHealth applications, but most of them are still in pilot phases, and most of them don't go actually beyond that. And in Mozambique is one of those countries that is still in development, and the many of mHealth applications there are still in the pilot phase. And most of those applications are developed to be used especially on the management level of the healthcare system. So they are developed for data collection and reporting within, for example, the ministry or the NGOs, just for the use of themselves. And what I propose is that we have to look at those applications, we have to develop health applications to reach the citizens, to get information to the citizens, to see how to improve their access to information. And we need to take a more user-centered approach within developing those applications. And we need also to take a socio-technical approach, which will mean that we will look also to the social context where those applications will be implemented and used, and not just get some mHealth application that is already built and just put it that. We also have to look at the context and all aspects of the context where those applications will be used, and also look at the user's needs. So to do that, we also have to include the users in the development process of those services and applications. We need to make the users to participate in the development process. So the basic aim of my research is to explore the service design in the process of developing this mHealth service for low resource communities. So my main research question is about the characteristics that this service needs to have when talking about these low resource communities, and specific for the mothers with young children in postnatal periods. So I'm basically using service design as a method to do my research. Service design is a user-based approach. It tries to have an holistic view and look at the context, aspects of the context, look at the user needs, look at the user will or is using the service and application, and not just based on the developer side of the service. So service design is being used in Europe, and many successful projects for developing user-centered applications, especially in the health sector. So what I'm saying is that every case is a case, and that methods needs to be adapted to the context. So I'm going to look at which service designs, methods, and tools will be more appropriate to these contexts and can contribute more for these contexts. So the service design tools and the holistic way can really contribute to not only build service that has the user needs in mind, but also it helps to improve the workflow of information between the service providers and the community as well, which is something that is very important as well. So within all the service designs, methods, and tools that I have available, what I'm going to look at, what I'm going to question is how all these tools can help me build an mHealth solution specifically for this contest, for the academic contest. What are the aspects in this context that I need to take into account? So what are the design characteristics, what are the design considerations that I need to take into account to come up with the mHealth solution which is specifically to this, that can respond to the specific needs of this context. So my research case is KaTembe. KaTembe is a municipal district in Mozambique. It's very close to the capital of Mozambique, but there still is an area of which very low resources and access to health service is still a problem. So this is the map of Mozambique. This is Mozambique, and KaTembe is here at the capital. This is the capital. KaTembe is just here across the bay of the main city of Mozambique. This is an aerial view of KaTembe. This is the main city, the capital city of Mozambique, and KaTembe is here, just across the bay, but still it is a very low resource community where the basic healthcare services are still scarce there. So those are pictures that I took from KaTembe from the research that I've been doing now. As we can see, it's a low resource community, and there are different communities there. There are parts that are really low resource with no energy, and sanitation is still a problem, but there are other parts that are more developed with energy access and mobile towers available for communication and everything else. So the basic philosophy of the service design, there are many proposed designs for research within service design, but what they try to say is that we first have to know the context, know the people that are in context, and then try to explore concepts that could fill in those contexts, and then frame solutions in the context with the people in that context, in the context, and in the final phase just realize the offering and show the service that we had in mind. So this my research design will basically be in 3 phases. I've done phase number 1, and I'm going to go to the other phases now, which phase number 1 is basically about doing interviews and getting to know the contest, getting to know the important stakeholders in the contest, and try to understand the underlying relationships in the contest. So the goal was understanding the community and the community needs. So basically what I did was went there in the community, get to know the community, get to know the healthcare context within that community, and see then how can I then generate ideas, understand better the requirements and needs of the community. So the first phase helped me answer some of the basic aspects of some of the research questions that I have. It gave me a better understanding of the context there. Some of those that understanding cannot be gathered from the simple literature that's available about KaTembe, which is not much. And I could map some of the results to some of the service design tools that will able me to continue this to generate ideas in the next phase within the community. So the questions that drive me through this phase, I just wanted to know how, where, and when do mothers in KaTembe go for health information. So, and what kind of information do they have access to? When do they have access to? And also I was trying to look at the advantages and opportunities of using mobile technologies in that community, and what kind of barriers, what kind of things they face to get access to health information. So these were the main themes that I found out that they are the information needs of mothers in KaTembe, and This is where they actually get access to those information, firstly at the healthcare centers, and then through activists in the neighborhoods and so on. This is a picture of one of KaTembe's health centers. There's one of the nurses giving a lecture about some of HIV health information that mothers normally attend those lectures. And also there are posters within the health facility for giving more information to the mothers. So using those results, I have mapped, as I say, to some of the service design tools. This is one of the tools. One of the things that the service design recommends is that we build up character profiles or personas within the data that we find. So based on the interviews, this is the profile of the mother in KaTembe, actually. She is basically a woman around 25 years old who has a child, and to go to the healthcare center, she normally lives far from the healthcare center. So to go there, she has to get public transportation, which is scarce in KaTembe, and that's one of the main barriers for them to get access to healthcare, is that the public transportation is scarce and it's not easy for them to get to one point to another. And her main activities are normally house chores and farming for subsistence. And the media and ICT tools that she normally has access and uses to get information or health information on the TV, and also mobile phones and radios. Regarding the mobile phones, there has been campaigns for immunization campaigns that send messages to everyone, actually, with immunization campaigns information in KaTembe. But the thing is that those messages are broadcast to only one mobile network, health information service. We can see that the woman relies on the nurses and treatment, and there's something that it needs to be looked further into. And of course, the areas that need to improve within the health information dissemination is, of course, equal access to health information, and there's a need to have target and timely information. What I mean by that is that information needs to be tailored to the specific needs of a mother, instead of broadcasting information for everyone. It would be good to see the specific needs of mothers and the babies, and to send to them just information that they found useful. And also coordination between the health facilities and the main stakeholders in the health information contests that are, so that there's a need to be coordination, because, for example, there are activists that go door to door in some neighborhoods, and the health committees or the health facilities don't know about them. So there's a need to be more coordination in that, so there are not redundant information being disclosed. And of course, what I've learned, if there's also a need to have a holistic view, we need to know the community. We need to understand the livelihoods of the community to have a better, to propose this service that will actually address the community needs and the difficulties that the community normally face. Also, this first phase of my research is basically to have a picture of the community still, and to have a picture of the community, see how KaTembe is, and I'll also get to know there's already some mobile information going through in the community. My next steps will be core design workshops, where with the community members, I will discuss the proposed solution of the service and see what they feel, how they feel about it, how they want it, and then the final step is, of course, to define the solution and the blueprint and propose the service that will specifically address these community needs. It will specifically address the KaTembe health information needs and access. So my contribution, theoretical, I hope to make it for a better understanding of those health information needs in KaTembe, and then propose a practical guideline of mHealth service for the community. So this is all. Thank you.